Hi everyone, my name is Jackie Barkness-Gardman. I'm a GI and liver pathologist at Johns Hopkins, and today I'm going to be discussing an interesting case of adenosquamous carcinoma of the colon. This is an important pattern to recognize histologically because it's associated with an increased risk of metastases and overall a poor prognosis compared to conventional adenocarcinoma. This also can be seen in patients with inflammatory bowel disease, although it can occur outside of that context. So let's go ahead and get started on this case. So today we have a colon resection specimen, and we can see that this has the full thickness of the colon. And I'm going to go ahead and zoom in, and before I look at the cancer, I'm going to look at the background mucosa. And what I see here is that I've got significant architectural distortion. I can see that I have branching of my crypts here. I have a bit of a villiform configuration to the surface, which could be seen if this was small bowel, but you can also get villiform changes to the surface in the colon in long-standing inflammatory bowel disease. So this fits with the IBD history. And I'm now going to go over to my neoplasm. So I can see that I have this infiltrative appearing neoplasm that's going at least into the muscle. We'll take a look when we get to higher magnification. And I do have another focus of tumor over here. All right, so as I go to higher magnification, I see an interesting morphology where I have these very pink nests of cells, which makes me think about squamous cell carcinoma, which in fact this is. So the pinkness indicates some degree of keratinization that is occurring here. I do have these interesting areas in the middle of some of these squamous nests where we have necrotic keratinocytes. This can be referred to as acantholysis in this setting and is something that can be seen in squamous cell carcinomas. So actually the majority of this has a squamous morphology to it. We do have some areas of more glandular looking differentiation if I kind of scroll around a bit. So for instance here, some of these little spaces are due to acantholysis and are just squamous, but there are some areas that could be trying to form little glands in here. And although I don't have it to show you today, we did do a mucicarmine stain on this to show that there was in fact some mucin production in this tumor. So taken together, we have actually here's some more areas that could potentially be glandular formation. So taken together, we ended up calling this a adenosquamous carcinoma. So here it looks like it's confined to the muscle. I'm going to go over to this piece over here. So just to orient ourselves, this is our luminal surface over here. We have this carcinoma with a desmoplastic stroma that's going into the muscle. And here we can even see that it's focally going through the muscle. So this would be a T3 adenosquamous carcinoma. Just to show you a little bit more of this morphology, here we have some of our really well-defined squamous nests. And in areas like this, we again have some areas that are just acantholysis, but there's some areas where it has a bit of a hint at glandular formation. And then the other interesting thing is that we have this black pigment here. This is just tattoo pigment, so presumably an endoscopist saw this lesion during a colonoscopy and marked the lesion for subsequent surgery. So that's our first slide for this case. Let's go on to our next slide. Same patient, just a different section. And this shows similar findings, although we see more extensive invasion into the surrounding adipose tissue. So looking at the background colon, we can again see significant architectural distortion. We're also getting a bit of serrations, which can be seen as a dysplastic change, but I'm not going to go too much into that today. And here again, we see this significant squamous differentiation, big squamous nests over here. And then we can see that this is going through the muscle and it's going the whole way out into the surrounding adipose tissue outside of the tumor. We have this grayish desmoplastic stromal response outside of this. So again, this part looks mostly squamous. We have potentially some glands admixed with the squamous component over here. So again, this is a rare variant of colon carcinoma called adenosquamous carcinoma, important to recognize due to its worse prognosis. Thank you for listening.